Hello, everybody. My name is Dr. Greg Curnew, and really pleased to talk to you about vaccines and cardiovascular health. So, why should a cardiologist talk about vaccines? Well, let me start off with a couple stories. First of all, a shark can definitely outswim you, and you can definitely outswim a shark. But if you compete against a shark in a triathlon, it comes down who can bike the fastest. So, this is me. When I heard about the pandemic that being healthy, body mass index over 23 increases the risk of complications from infections. I start to work at new ways to be healthier. So here I am at this Tin Man competition. You can see that almost everybody's gone. I'm good at finishing last in these events. And so I'm trying to get healthier, lose 20 pounds, and things are good. So that's one way to get your immune system to be stronger. On the bottom, you see the slide of a grandpa and a little grandchild. First of all is atherosclerosis. We treat in older people like grandpa, but atherosclerosis starts early in life, and so we need to think about long-term benefits. One of the things is that young people have good immune systems. Older people their immune systems start to fail. So when you're in your teenage years, that's your peak of immunity. At 50, it takes a big decay. At 60, it even takes a further decline. So that's why things like infections become more problematic as we get older. So first rule is keep your immune system stronger. Try to be active as much as you can. And also is that time for, we got good at vaccinating young people, but we don't think about vaccinating old people as well. So things to think about in that domain there. So let me tell you about a case I looked after. So Beverly is a lady that comes to my office with shortness of breath, and shortness of breath is very common in your practice. And she has congestive heart failure. And let me show you some things about her history. So she had a TIA back in the 1970s, and she went for gastric bypass. And when she saw me, she had heart failure, class 3 to 4 congestive heart failure. Her legs were swollen. She was short of breath. Her blood pressure was okay. She was a little bit overweight. And she also had chronic atrial fibrillation. She was anemic. And here's her typical presentation. Like all cardiologists, is that in your management, your practice, you do an echocardiogram. So we got comfortable with systolic dysfunction, but the most common cause of heart failure now is diastolic dysfunction, stiffened heart muscles. The heart muscles thicken, the valves are leaky, the left atrium is enlarged. Atrial fibrillation is a marker for congestive heart failure. Her blood chemistry shows no diabetes, but one of the markers that we're measuring quite more and more is called proBNP. Hers is over 2,000, which is a marker for congestive heart failure. She's on her traditional medications for atrial fibrillation, a NOAC. She's on beta blockers. She's on some diuretics. She's on spironolactone. And she's actually participated in the EMPEROR Congestive Heart Failure Preserved, and that trial was positive, and she's on Jardiance for that as well. So the effect of congestive heart failure and SGLTs are independent of that effect. But she's also a very smart lady. She visits her husband in a nursing home. She's seen pneumonias to people, and she says, am I protected? Am I managing my heart failure and my other disease processes really well? And the answer is that pneumococcal pneumonia, which Dr. Grossman is going to talk a lot about, is probably the most common bacterial pneumonia as we get older. It has a high mortality of over 10%, and especially important over the age of 65 or so. We know that younger people with risk factors are in trouble. As we get older, the immune system gets weaker. So Dr. Grossman is going to talk to you a lot more about pneumococcal pneumonia and its burden, but also any infection can probably damage the vessels in the heart and lead to heart failure and to myocardial infarction. So one of the things is that these are risk factors for pneumonia. These are also risk factors for heart disease. So having lung disease, smoking history, damages your lungs, damages your heart. And as you get older, the risk of complications from pneumonia for heart disease and for lung disease go up dramatically. So having heart disease, having lung disease, having diabetes, smoking history, renal insufficiency, hypertension, they're all detriment to your vascular health and also to inflammation, to heart disease, and to pneumonias. And that combination is a deadly combination. So let's explore this. So Beverly was smart, is that part of her management of heart failure, she goes for annual flu shots, she got all her vaccinations. We're treating her well for her heart failure. She stopped smoking. In fact, she actually got COVID. I was actually quite surprised. She visits her husband in a nursing home, and when she told me she was COVID positive, I was, no, you can't be. You have all the risk factors for bad outcome. But she had 2 COVID tests, and she was indeed positive. But she really had almost no symptoms from her COVID. So when you think you know everything, you still have a lot to learn. So, but to manage her heart failure is managing infectious disease well, because this is a pattern which you're going to see in diastolic heart failure. And you're going to see that these people will have lung problems, heart problems, kidney problems, diabetes problems. And you can see that diastolic heart failure is a disease of a multi-system effect. So I'm short of breath for all sorts of reasons. And you mentioned that she was taking medications for heart failure. And the newest information on preserved LV function, called Emperor Preserved, showed that you have a 21% reduction in hospitalization for heart failure. The problem is that that's good. The bad thing is that over 80% of hospitalizations have nothing to do with heart failure. So things like lung problems. So think about her kidneys, think about her lungs as well. So in her repertoire of thinking, we need to think of more just atrial fibrillation management. So here's basically the CHAD score for atrial fibrillation. You know that well. But this is actually the CHAD score for basically infection as well. So and these are risk factors for both heart disease, atrial fibrillation, stroke, cardiovascular disease, and infection. So I have this modified CHAD scoring system. So if you have any chronic disease, coronary disease, COPD, you're at risk for complications from things like influenza, from pneumococcal pneumonia, other infections that will unfortunately end your life and make it harder. So we know that people who have HIV have a weakened immune system. They're more prone to coronary atherosclerosis. They're more prone to pneumonias as well. At one time we thought alcohol was good for you. It's now a type 1 carcinogen. And so that leads to basically atrial fibrillation, other problems as well. So kidneys, lungs, dementia, strokes are all intertwined. So take a look at that slide. You may want to take a picture of that. So when you think of CHADs, we think of atrial fibrillation, stroke prevention. I also think of CHADs as well in a modified version for lung disease and for pneumonias as well, and for heart disease as well. So what Beverly did, she came to my clinic, and her heart failure was well managed. And I happened to be lucky to work next to a wonderful pharmacist called Rami here at Shoppers Drug Mart. And she went downstairs after her visit, and she got Prevnar 13. And you're going to hear more about Dr. Grossman about that. So basically for her, even though she's a senior, she had to pay for that vaccine, but very happy to pay for it. And she's also fully immunized, and she's thinking about her health on multiple levels. And this has changed my practice. I never thought as a cardiologist I would be recommending vaccination. And here's a situation when you look at this, and you as family doctors are doing this on a regular basis. You are counseling people and doing a wonderful job. I think we've all learned different things about vaccines. And I think we've all become more expert. And I never thought of vaccines too much, but now I think of it every day and think of how important it is. And you know, for instance, last year in Ontario during the so-called flu epidemic, we only had 69 cases of across Canada confirmed influenza. Normally we have about 52,000 cases per year. So you can talk about, as being by isolated, social distancing, hand washing, and face masks have a great impact as well on this. So these are things that I'm going to carry forwards for the rest of my life when to use these maneuvers. I thought they were kind of funny at first, but they work and they're so powerful tools. What I didn't realize is that if you get hospitalized for influenza, 1 in 8 adults will develop a serious cardiovascular complication in the ensuing months afterwards. And that if you have influenza, heart attacks are 6 times more higher incidence in the next few months afterwards. So it looks like is that infections, and Dr. Grossman will tell you more about pneumococcal. It's the same thing. If any infection, we think infection is localized to one territory. The reality is infections may start in the lungs, but they'll spread to other areas. They damage vessels, they damage heart tissue, kidney tissue, brain tissue. I want as few infections as I possibly can. And so the data about influenza and pneumonia has been around for a long time. We also realize that it causes cardiovascular complications. The question is, can you prevent this? So this is a randomized controlled trial that was presented at the European Cardiology meeting this August. This to me is one of the most influential trials of that whole meeting. They took 2,500 patients or thereabouts who basically came to hospital with acute coronary syndrome, and on 3 consecutive flu seasons, they were given a randomization to an influenza shot or a placebo influenza shot. So they either got the influenza vaccine or a placebo to that, and looked at cardiovascular outcomes 1 year later. So that's kind of interesting. Who would think about giving the flu shot when you're having your heart attack during flu season? And the reasons you saw the rates were quite higher, but the results were spectacular. This is a 28% reduction in cardiovascular events. I'll repeat that. By giving one simple flu shot during flu season, you decrease cardiovascular complications, myocardial infarction, cardiovascular events by 28%. Even more importantly, it's hard to show reduction in mortality rate now. This is actually a 41% reduction in all-cause mortality or cardiovascular mortality. Let's think about this, is that we had previous data saying that we had observational data that those individuals after influenza have a higher cardiovascular complication rate, and that there was some data suggestive that in predominantly observational small randomized data sets that getting the flu shot made a difference. This actually shows without a shadow of doubt that randomization shows that part of the repertoire of cardiovascular disease when you get admitted to hospital during flu season is to get the flu shot. So this is something we need to think about. Now, you, as most physicians, getting your patient immunized on a regular basis is important. There's just one more reason to look at this, because vaccines have been around for a long time. They showed reductions in cardiovascular events, but more importantly, vaccines of the past, measles, pertussis, mumps, diseases that I really don't know much about, have been basically lifted off the face of the world. And at one time, childhood mortality was a major issue. Now it's come down dramatically, in fact, this is the advent of good vaccination policies that you do on a regular basis. So if we think about this, is that why should the flu shot prevent cardiovascular outcomes such as a heart attack or need for stenting? One is that obviously by preventing influenza will damage blood vessels, will cause myocardial necrosis, and that will have a benefit. But the effect is really not explained by influenza itself, because most people don't get influenza, yet the reduction in cardiovascular events takes place. Now, the study didn't do a great job of looking those that got influenza who did not, but it's believed that the vaccine stimulates your immune system to fight atherosclerosis. And these are nice, beautiful slides saying that, and there's actually data from observational data that the same thing happens with pneumococcal vaccines as well, is that basically infections damage vessels, but also by giving the vaccine, you're boosting your immune system to prevent atherosclerosis. So this happens to be Prevnar 13. You're going to hear a lot about more right now, is that it affects immunity on a long-term basis. And so to me is that what I'm thinking right now is that I'm certainly going to give the flu shot to everybody, or recommend that, but also encouraging to get all proper vaccinations, including pneumococcal vaccines as well. So traditionally we tend to vaccinate older individuals or people at risk. But I need to think about that a little bit more, is that if I go back to my story about cholesterol, when we first started about cholesterol management, we wait till you're an older person at risk for vascular disease, then we treat your cholesterol. We now realize it's the burden of LDL cholesterol that's important. We know it's a burden of infection that can damage vessels over a lifetime. So I think you need to reconsider vaccinating much earlier. So what I did is that part of this pandemic situation, I'm boosting my immune system, and there's actually data that diet and lifestyle changes, predominantly more plant-based eating, for instance, losing weight, are really important for your cardiovascular health and also for your immune health as well. So encouragement and proper vaccinations. So I'm getting all my vaccinations at this point in time. You know the schedule of these vaccinations. You do a wonderful job on a regular basis of vaccinating people. And if you look at this is actually a key slide to me. Take a look at this, is that you come to hospital and you have that rupture of an atherosclerotic plaque. You go to the CAT lab, you get an angioplasty, you leave the hospital, and everybody says, wow, thank you for saving my life. Well, you know what? 8 out of 10 heart attacks are preventable, and that's failed prevention. If you go back to the beginning of that slide, look at these monocytes, LDL particles. So that we know that oxidized LDL cholesterol damages vessels. We know that lymphocytes, monocytes, neutrophils are part of the plaque. So this interaction of atherosclerosis takes place at a very early phase. So wouldn't it be better to prevent the plaque from getting bigger, from rupturing? And you just saw the data with just a simple influenza vaccine had a direct impact on decreasing cardiovascular events by almost a third and decreasing mortality by about 40%. So this is important, and it's important to really think about vaccinations in the heart, because we've done a good job at lowering cholesterol, lowering blood pressure, but we all realize that there are other factors that prevent or cause heart disease. And one clearly is inflammation. And I didn't really think too much about inflammation, but now, boy, is that inflammation is everywhere. The more overweight you are, the more inflammation, the more diabetes, the more infections, you're in trouble. This happens to be a trial with colchicine, an anti-inflammatory medication that was used prior to hospitalization, and it had an impact on decreasing events for COVID. There's another trial which in hospitalized patients that didn't do quite as well. We have 2 trials in coronary artery disease and either acute coronary syndrome or chronic stable disease that colchicine decreases cardiovascular events. So if you lived in Montreal, the Montreal Heart Institution, everybody would go home on 0.5 or 0.6 of colchicine. I'm starting to add colchicine as part of my repertoire to prevent atherosclerosis. And so you're going to hear more about that. So again, inflammation plays a role. And I think you've seen slides such as this, is that we're not very good at treating inflammation when it's far advanced. We have these immune suppressor agents that help a bit, but a simple vaccine, and is that truly amazing. We have very powerful vaccines in any circumstance, and that the COVID vaccines right now, they're still 90% effective at reducing deaths or hospitalization from COVID. They have some protection against spreading disease, but the biggest effect is decreasing severity of disease. And so we're going to have newer vaccines, combination vaccines that are going to be looked in that scenario. So just think about how to be vaccinating this anyway. So this world is very complicated when you cause atherosclerosis. You see this plaque, this heart disease. I put the heart as the center of the universe, but it's just part of that. And inflammation, heart disease, are all playing a major role in this circumstance. We start off in thinking is that, what about things like vasculitis? I just heard a great talk on vasculitis, inflammation, where the immune system has gone wrong, these skin lesions. We don't see too much of them. And what I learned is, simply put, is that things like in the first year after vasculitis, you probably die of infection because you're suppressing the immune system maybe too much, or the vasculitis. But after the first year, you stabilize the vasculitis, is you look at cardiovascular disease becomes one of the leading morbidity and mortality. And so people who have vasculitis, inflammation, are 3 to 4 times more likely to have cardiovascular events. Again, another evidence that inflammation is playing such a crucial role in all this. So I started saying that we should think about how to properly treat heart disease, and we still need to go back to our beginnings. And this is I'm really proud of our team. We put over 200 videos together on YouTube, and this just talks about hypertension. One of the things about hypertension is that what's the best target of blood pressure? Well, there was just a recent trial that showed that for the Chinese population, is that a blood pressure strategy of 110 to 130 is better than 130 to 140 for blood pressure reduction. So getting blood pressure lower decreases cardiovascular further. Controlling cholesterol is important. Managing all your risk factors from smoking are really quite important. And I hope some of these videos help you as well. But the role of inflammation is a crucial factor right now. A good doctor cures disease and treats well. A better doctor prevents disease. So you see on the bottom the polio epidemic, the iron lung that just see pictures of. And sorry, I was just talking to one of my patients that gave me stories about this. She was a nurse. On the top, you see grandpa and grandchild. We all want to be around for as long as we can. And we know that our immune system starts to fail. Our immune system peaks when we're the age of 12 years of age. and we have lots more inflammatory cells that fight. As we get older, starting the age of 50 years of age, immune system shows a big degradation. Over the age of 60, takes a better degradation. We're going to still fight all these things of what people want, but vaccines have made a great impact. And my hope is that we think that a little bit better. And I now realize that influenza vaccines decrease cardiovascular events. I'm hoping there'll be a trial with Prevnar 13 or the Prevnar 25, whatever the serotypes that will be developed as time goes on, because as the disease goes, there'll be more mutations. But right now we can make a huge impact on this. And we vaccinate well our young people. We haven't really vaccinated as well as we can older people. So when you think about retirement, think about your vaccination status. I rethought mine. What I did to boost my immune system, I worked at weight reduction, regular exercise, and trying to be useful for as long as I can. I hope you think about that too as well, and for your patient population. So I'm now developing with our local pharmacists a pathway to get proper vaccinations from shingles to pneumococcus to influenza. And I still think is that lifestyle changes are the key to quality of life, to longevity. We have our book called 30 Days to Healthier You. Vaccines are important. This is the American heart saying that we can't forget all the basic lifestyle changes. And my plea to you is to think about how to work better together. So we have this book called 30 Days to Healthier You. If you go to our YouTube site and put Dr. Curnew, look at a video, give my office a call. We'll be glad to give you one of those books. And if we can help anywhere, there's our email address. I left my cell phone. You need to get a hold of me, contact me, want to work together with you. So the world of vaccines has changed quite a bit. And I made the mistake of not thinking about that in my repertoire. I hope you think about this better. I thank you very much for your attention. And what we're doing is try and make the world a little bit better. And vaccination is certainly one way to do that. Thank you so much. Have a great day.